right, looks like we're getting ready to go. All right, let's see how this goes. This is going to be interesting. All right, just to reiterate, now that we are back here in problem pitch land, one. Oh, thank you. Music off. All right, now that we're back here, now we're in problem pitch land. We're getting ready to pitch our problems. Remember, this is a supportive event. We're not here to judge. We're not here to we don't care whether or not it's the first time or the 100th time you've gotten up and spoken in front of a group. We just want to hear what you're passionate about. All right. So that being said, first thing, make sure your Zoom name matches the name that you submitted on the form so that we can find you. Okay, that's one thing, very important. Two, we're going to call you up and we're going to give you a number. Don't forget about that. We're going to do that. Three, 60 seconds. That's my job, the time. So let me make sure I do that well. I'm going to be timing you. And for the sake of time, I will mute you if you go over 60 seconds, okay? I might give you a little bit of a grace period. Depends on how I'm feeling tonight. A little bit better now that I had some peanut chews. Problems only. No pitching solutions. Only problems. Next, no slides. We do not need slides tonight. Do not make slides for a 60-second description of our problem. Slides will only be for the final presentation. And just a reminder, we will record. These pitches are being recorded, and we will be posting them, both the recording and the spreadsheet of the problem pitches, shortly after this session so that you can find people. Now, moving on to networking. So as soon as this session is over, we are moving over to Slack, right? So everybody will be in Slack to discuss the problems, find people who get pitched problems, for people who's heard problems, finding those people the other way, or finding people, join your team, all those things. That happens all in Slack. Like I said, join your channel using the plus button according to the number that we assign you during these presentations. Stick around there, keep an eye on it, see who wants to join your team. If you want to find somebody, you have to join their channel according to that number, right? Join that number channel according to the pitch presentation number. That's how you track somebody down who gave a pitch. And then remember features like huddle. If you start a huddle, anybody who's in the channel with you will be able to hear you. Don't forget that. And if you join a team, and if you join a channel and a huddle is in progress, you'll see a little, looks like an antenna sort of with lines around it next to that channel name. You have to turn your huddle on too in order to hear everybody and chat. All right, without further ado, here's the Slack things. Oh, I forgot I made this slide. So yes, here's the huddle feature. That's what it looks like. You can see me spinning around here in circles. You just toggle that little thing on to huddle. And if you want to start a call with somebody, like a Zoomish like call, there's a little phone thing here on the upper right if you DM somebody. But if you're in a channel, you click on the members of that channel on the upper right, and you can start a call. But yeah, okay, I think that's it. All right, are we ready? We're ready. Apparently I have a twin in the audience. Hello, Tomer Z. We clearly were separated at birth, and I appreciate your hairstyle. All right. Kathy, what is our first problem and number? I need you to. I think you should just actually go on audio and say that. Or you can come sit next. Who's mic? She doesn't have a mic. No, she doesn't. No, I have it on mute. I have it muted. Yeah. Yep. Thank you.
All right, Hal, you're going to be asked to unmute.
Bear with us 1 second.
All right, I think that was me. Hal?
All right, there we go. Go for it. You have, hold on. And setting the timer for 1 minute. You're going to hear it beep because I'm going to hold it up next to the microphone. Ready, Hal?
All right.
All right, and go for it.
All right. So monitoring patients while switching psychotropic medicine is critical, and more support is needed to help psychologists monitor medicine reactions between sessions. So many people experience severe reactions to psychotropic medicines, which can range from seizures to Parkinson's-like symptoms. Due to a shortage of providers and long waiting periods to see psychologists, especially during the midst of COVID, patients are left waiting to change their meds, and this lapse of care can impact a person's ability to manage their activities of daily living while simultaneously managing negative reactions that they might be having. This can cause unnecessary trips to the ER or psychiatric hospitals that could otherwise be prevented. So I present this as a problem for the mental health track as we think about access to mental health services during the time of COVID.
Excellent. You got it right under the thing, even though I set a timer for an hour, but still now the minute is currently up. Good job. Thank you, Hal. So that is number one. That was number one. So just so everybody remembers. All right. Next up. So John Hall, you are number two. John Hall, you are up with number two. Greg, you got it?
If your name is called, please raise your hand. That makes it easy for us to find you.
Yeah, if you use the raise hand function in Zoom, it makes it easier for us to track you down.
I don't see him.
All right, last call for John Hall. All right, next up. Travidi Dewani, you're up. All right, I see you. Good job. All right, ready? And you can go.
Hello. So our problem is how might we bridge gap between healthcare access and sex workers? Every person has a right to healthcare and without featuring by those who have power over their health access. 60% of the sex workers fear and have trust issues into their healthcare providers or general urgent cares and the clinics that they visit for their problems. So we want to bridge the gap between access to healthcare, proper tests and medical care for sex workers with the help of technology.
Excellent. Thank you. All right, next up, number three is Tatiana Guerrero David. Oh, hold on. All right. So number five is here in the house. Raise your hand. Come on up. Mike is hot. Right here. Just stand in front of that camera and hold that mic.
Oh my God. Okay.
Yep, right over the camera's right there.
Okay. All right. So my pitch is to address mental health with the COVID pandemic for track number one. So as we emerge from the COVID-19 pandemic, I want to raise awareness of the pandemic's impact on the mental health of at-risk adolescents and young adults living in under-resourced communities. Isolation and lack of access to familiar routines increases their risk to consider dropping out of school, experiencing mental health challenges, and even experiencing homelessness and resorting to alternative coping mechanisms. I feel that early detection is already lacking prior to the pandemic, and I think it's been exacerbated with the COVID restrictions. Also, just having to navigate the healthcare system, and they've been in school and then virtually, and then now they're transitioning into independent living, and it's just making it a lot harder and exacerbating, like I said, mental health challenges, which can then be more severe and eventually lead to chronic conditions or just not receiving quality or necessary health care. Eventually that could lead to, higher costs for them in the long run and for providers.
All right, thank you very much. That was number 5. Just to reiterate, that was number 5. All right, John Hall, we called you a little bit ago, but we didn't see you. Do you want to give your pitch? I see you now. You'll be unmuted momentarily.
Rob, when you get a moment, turn off the mic.
Yeah, 1 second, John. Give us a second. We can't hear you yet.
Should receive the prompt to unmute.
Yeah, look for a button that popped up, John, to unmute. All right, we'll come back to you, John. All right, next up. All right, I apologize to everybody for botching your name, but I'm doing my best. Seema Anis. Seema Anis, you are up next with pitch number 6.
Hi, can you hear me and see me
Yep.
as well?
Loud and clear. Looks good. Go ahead.
Are you able to see me?
Yep.
Okay, so I'm going to make a pitch from the mental health track, specifically because I'm an employee at Jefferson University Hospital System as an IS&T Medical Information Officer. Recently, we experienced a big tragedy that unfolded in a loss. However, what we don't know is that there may or may not have been a mental health component. In the US, 20.6% or almost 21% of people suffer mental illness. About 20 or 60% of those are diagnosed by age 14. We would like to know how many people at this point are suffering on a daily basis, given the COVID and even pre-COVID underdiagnosed situations. My pitch is today to propose a solution to this so we can actually do something about it. How do we propose a solution? There are several avenues that one can go. One of them is health tech, because I work in technology. I'm obviously gravitating towards that. However, to find that solution perfectly and in the best possible way, I'm here to pitch this idea and for others to help me solve that issue.
Perfect. Thank you. Right on time. All right. Next up is Hal Martin with pitch number 7. So that the last one was. Yep. Last one was 6. This is now pitch number 7.
All right. Hey again. So I have a new pitch for patient devices. I'm an occupational therapy student, and this is a problem that comes up a lot in my classes, especially in the midst of telehealth and the reliance on technology. So children are exposed to technology such as iPads from a much earlier age, and it's not uncommon to see toddlers preoccupied with an iPad, for example, while taking transit. And while this technology makes for good distractions and it has many benefits, pediatric therapists are increasingly concerned that these devices prevent young children from exploring and interacting with their environments, and therefore may be stunting the development of age-appropriate skills, such as grasp patterns. So this is a unique problem for the patient devices and wearables track.
All right. Thank you. Just under time. All right, that was pitch 7. Next up, Zain Syed, pitch number 8. Zain Syed, you're up.
Hey everyone, so my pitch is creating a platform that allows patients to control their data and be able to share it with whoever they want to, like family members. And also with this platform, being able to monetize their data. So a lot of times you have patients with oncology patients that have debilitating diseases that don't allow them to keep their jobs. And recently I was reading an article where it says an oncology patient, a de-identified oncology patient is worth almost $1,500. So that's my pitch.
Short and sweet. Thank you. All right, next up. Pitch number 9 is Chad Thomas. Chad's in the room, so it looks like he's going to come up. Just going to turn the mic on. That's the camera. You can stand right here and look at that camera on the tripod. And Letty will get you a microphone right here in front.
Camera here?
There's the camera right there.
Oh, yeah, sure. I got you. Okay. So I work in the emergency department. So my problem is that, we're very overutilized and overwhelmed. There's many different areas within that could potentially apply, but trying to, improve throughput, better provide access to care providers and specialists, kind of decentralizing that in a sense, or, technology could play into that in a lot of different ways. And trying to better utilize the process within the hospital as well to make that more efficient. That's my problem.
All right, thank you. That was pitch number 9. Okay. All right, we're going to try John Hall again because you're bearing with us. Thank you, everybody, for bearing with us on this. It's the first time doing this virtually, and I'm starting to get into the swing of things. I'm feeling a little bit smooth. All right, John, are you with us? What's our number? What's John's number? 2. John is number 2. Sorry, that was Chad's. John? All right, we're getting closer. You look unmuted, John, but we'll figure it out by the end of this. Don't worry. All right, moving on. Next. No, we can't hear you. Sorry. Sometimes leaving the meeting and coming back in fixes things. So give that a shot. We'll still be here. Don't worry. All right, next up. All right, Alfred Atanda is up next with pitch number 10. Pitch number 10. Yeah. But your number will be. Yep. All right, so just look right into that camera right there. And this is pitch number 10.
Great, thanks everybody. My name is Alfred Atanda. I'm a pediatric orthopedic surgeon in Wilmington, Delaware, but I also have a role as the director of clinician well-being at our hospital. A lot of folks in the audience and at home may know that physician burnout is a huge problem that specifically has been exacerbated by the COVID-19 pandemic. If you think of the analogy of the canary in the gold mine, when the canary has an issue and passes out or dies, then you have to change the environment and improve the environment conditions for the canary. The same thing happens for physicians. Historically, we looked at a lot of individually based solutions to help physicians, but now we know that it's systems level based interventions that are most useful. Think of sending construction workers and other folks to a job site without a hard hat, without boots, without eye protection. The same thing goes for physicians. So we have to come up with solutions that can identify burnout, support physicians who are experiencing burnout, which will ultimately help patients and patient outcomes in the long run. Thank you.
Excellent. Thank you very much. That was pitch number 10. Pitch number 10. All right, next up we have pitch number 11. Shivam Goel. There you are. All right. Floor is yours.
Hi, I'm Shivam. So the mental health issues among workplaces are near universal. Employees say that the model of current working isn't really working for them. The impact of this is that employees are leaving their jobs for mental health. The productivity rate has decreased, but there's some bright spots too. Talking about mental health at work has increasingly the norm, and companies have started to invest in mental health. Right. The problem statement that I want to work on is the anxiety amongst employees have increased and the productivity has decreased with the remote work. So how can companies really leverage technology to cultivate a safe and supportive organizational culture for mental health by integrating practices in day-to-day work while still maintaining a sustainable culture for it?
Fantastic. Thank you. Excellent time management by everybody. You've all done this before, haven't you? All right, moving on. That was pitch number 11. That was pitch number 11. Moving on to pitch number 12. Ruth Jaminwa. And again, I'm sorry if I botch your names. I will apologize to you in person later. Pitch number 12 is Ruth Jaminwa.
Okay, can you hear me well?
There you are. Thank you. Yes, we can. Go for it.
Okay. So 1 in 12 American adults, which is over 20 million people, are living with a substance use disorder. And the US spends over 300 billion, for example, for tobacco use alone. And there are medications to help people who are living with substance use disorders to treat them, yet they don't perceive a need for treatment. So what I would like to see is helping these people see the harm that this substance disorder is causing them so that they can enroll for treatment.
All right. Thank you very much. That was pitch number 12. Thank you, Ruth. Moving on to the next one. Nasim Maya. All right, we got an in-person one. Come on up. Fire up the mic and your camera. You're looking right in that camera there on the tripod.
Hello, everyone. My problem is more personal and more anecdotal. So,
Oh, hold on 1 second. Sorry.
Yeah.
You're not hearing his audio? Oh, the camera. Got it now?
All right.
All right, go for it.
Yeah. My problem is more anecdotal and personal. I'm not sure how relevant this is to every healthcare as a whole, but 2 months ago, my grandmother, in a routine screening, they found a growth in her colon, and further testing and screening and more intensive screening would be required to figure out what it was really. But my grandma's a bit too frail for that. I thought it'd be nice if in that initial screening we could have more insight, not necessarily prescriptive insight, but just general an idea of what's going on. And I think if you can squeeze out more information from these initial scans, CT scans, and whatnot, I think it'd help a lot of people just have a better idea of what's going on with the family.
All right, thank you very much. That was pitch number 13. Sorry, I had 12 on in the beginning. Just to be clear, that was pitch number 13. Give me 1 second. All right, next up, pitch number 14 is AJ Wellner.
Sorry, can you hear me?
We hear you. All right, we will, and go for it.
When it comes to clinical trials and how much they can cost, I believe they're often brushed underneath the rug. Clinical trials are expensive as they are considered experimental trials. They cost extraneous amounts of money, going up to numbers that can vary from tens of thousands of dollars to hundreds of thousands of dollars. And most insurance do not cover these costs because they consider the nature of clinical trials as experimental, which means that most people who are limited in mobility or are disabled and have these opportunities to do the clinical trials will be in lifelong debt, which is unfair because healthcare should be a right and not a privilege, meaning that people who have these opportunities should have low cost or accessible opportunities to them.
Excellent. Thank you very much. Next up, that was pitch number 14. That was pitch number 14. Next up, we have pitch number 15. I'm going to go with Shivy Duraseri. And again, I'm very sorry. I'm very sorry.
Hello, everyone.
Hello, we got you. You're up. Go for it.
Yeah. So I want to pitch in the problems regarding mental disorders among children who are described as serious changes because children typically learn, behave, or handle their emotions, which cause distress and problems getting through the day. Many children occasionally also experience fears and worries and disruptive display orders. So I want to come up with the solutions which are such as interactive web tools and screening tools, which can help to solve these problems. and help them dealing their thoughts and feelings in a particular manner. Thank you.
Thank you very much. That was number 15. That was pitch number 15. Next up, number 16. Danielle Kempner, pitch number 16. Danielle Kempner. Yeah. All right. We got Faith. There's your camera right there. Let me give you a mic.
Hi, I'm not Danielle, but we switched. So what I would like to be targeting is communication challenges in people with dementia. It's really hard for people to develop new systems for communication, especially as you're aging and have been familiar with one for your whole life. For people whose whole life communication has not been a challenge, but recently due to new health conditions, it becomes a challenge. It's really hard to develop new skills for communication. I'm looking for a solution to address this challenge with an aging population who has limited technological skills.
Thank you very much. All right, next up. I do miss the applauses. I'm going to just do a little mini applause for everybody who's pitched so far. You're all doing so freaking awesome. All right, next up we have pitch. That was pitch number 16, correct? That was pitch number 16. Next up is pitch number 17. Bassam Alasali.
Hello?
We can hear you.
We can hear you. Awesome.
You're up.
You're up. Can you see me?
Yep, go for it.
Okay. Awesome. So this is just I have two submissions. This is the genome sequencing one.
Correct. You are correct.
Okay. So genome sequencing is an effective tool for preventative medicine and is, as well as informing primary and emergency medical care. Despite this, many people particularly have a disadvantage due to certain backgrounds that lack the ability to pay for the benefits of this health tool, despite their disproportionate need due to the health risk factors disproportionately affecting many of these communities. We need a way to make this tool more accessible to these populations. Additionally, researchers are limited in the scope of population-wide genomic data, which could help unveil new medical breakthroughs. There are no incentives currently for individuals who can afford it to get their genome sequenced against the risk that their data will be owned by someone other than themselves and can be used to develop technology that they don't benefit from. If we could increase access to that data, we could help not only improve the lives of many people, but contribute to substantial breakthroughs in the healthcare paradigm.
Awesome. Thank you.
Thank you.
That was number 17. That was pitch number 17. Next up is number 18. Hal Martin, you're back. Got so many ideas. It's good. Love it.
All right, I'm back this time with one for the third track. So with the rise of flashy web development tools that allow for more interactive media, websites and apps are becoming more complex. And this presents a unique challenge for online healthcare platforms, as they must consider accessibility for all their users. These tools are often cause websites to be inaccessible to things like screen readers and other assistive technology that are often incompatible or not considered in the design of these platforms. I'd like to pitch this as a problem for the healthcare digital divide track, bridging the gap between assistive technology and the people who rely on it and access to online healthcare services.
Amazing. Thank you. That was pitch number 18. Pitch number 18. Next up, pitch number 19. Francis Cawthorn is number 19. Francis Cawthorn. There you are. Coming up to the mic. Mic's hot. Camera's right there. There you go. Perfect.
Okay.
Yep, you're good. Go for it.
There is a very high incidence of homicides in the Philadelphia area, and part of the problem is the kids know what's going on, but they're not saying anything because they don't trust adults, or they don't trust the police. And the idea would be to set up a a board, a whiteboard or something like that on the internet with a subscription fee in which the kids anonymously could identify continuing problems amongst their peers. They'll help each other. They want to save a friend, but they don't want to get involved with adults. They don't want to get involved and be called a snitch. So the kids know what's going on, but they're afraid to put it in a public forum. So that's the problem.
Thank you. Here, we'll take the mic. I'll take the mic. I'll take the mic. Hand it over. Hand it over. Yeah. Thanks. Just for this one. All right. Next up, playing the role of John Hall is Lauren Schlegel.
Oh, okay.
Lauren, thank you, John, for being patient with us. We're going to read John's description because we can't get his audio up. So go for it. This is John Hall. This is pitch number 2.
Yeah. All right. So this is John Hall. Virility monitoring and assessment. Objective, functional, and virility measures are important for clinical and research assessments of older adults. The reliance on telehealth and remote data collection during the COVID-19 pandemic has prevented many in-person assessments in the clinical and research settings. As such, many healthcare providers and investigators have been left to determine the feasibility of collecting functional and virility measures remotely over video conferencing with little guidance on safe and standardized approaches for virility assessments.
Thank you, John. That was pitch number 2. Pitch number 2. All right, next up, we're going back down to pitch number 20. Pitch number 20 is Tomer Zilberstein. Tomer Zilberstein.
Hi.
Oh, hold on. I can hear you, but very quietly.
Hello.
There you go. Speak up.
Any better now?
Yeah, for some reason it's really quiet, but we can just hear you.
I'll try and speak loud then.
I love it. Perfect. All right, go for it. That was perfect. Go for it.
Okay. I submitted 2 of them. Which one is this for?
Hold on. Okay, go ahead. Starts with healthcare personnel shortages.
Okay, so there is a healthcare personnel shortage in our country. Now, that does not only mean that there are not enough doctors, because we actually do have enough doctors. We just don't have them in the right locations or in the right specialties. But this exists for many different healthcare professions. And so by not having the right healthcare personnel in the right location, we are creating healthcare, or we're contributing to healthcare disparities amongst various disadvantaged groups. But this problem can compound other issues that these groups are facing, leading to many of the disproportionate health inequities that we see today.
Excellent. Thank you very much. That was pitch number 20. Pitch number 20 from the dude who looks like he's my twin, but I swear we're not related. Great job. Pitch number 21 is Latte Seltzer. Oh, you're Latte? Okay, fantastic. Okay, this is going to be an in-person one.
Hi, so I'm not Lottie, I'm Danielle this time. We switched. But yeah, so my pitch is on validating COVID long haul symptoms and survivors. Since the beginning of the pandemic, now that we've had it going for over a year, year and a half, 2 years almost now, maybe more, depending on when you think it started. I myself am a long hauler, and it's really hard going about trying to find support for long haulers. And connecting to other individuals who are experiencing the same thing. So figuring out a way to connect not only individuals, but professionals that actually are interested in studying this and can actually speak to the symptoms I'm having is definitely a needed support system.
Thank you very much. That was pitch number 21. 21. All right, 22. Tomer, you're up again. 22. Hold on, let me restart the timer.
Can you hear me now?
Yep, go for it.
So the COVID pandemic brought about a fundamental shift in how people are willing and able to access healthcare. One big way that people access healthcare is through support networks, such as Alcoholics Anonymous, Narcotics Anonymous, trauma support groups, such as for sexual assault survivors, or for people living with mortal conditions, such as end-of-life terminal cancer. Additionally, for group therapy sessions, for example, for kids with autism or other needs that need to be addressed and practiced in safe spaces online. This has resulted in a need for these people to be able to access these resources, which they can't access in person. Now, it's not as simple as finding a Zoom call. They need to have a way to actually meet these groups and also, in certain cases, remain anonymous while still ensuring the safety of these people.
Excellent. Thank you very much. That was pitch number 20. Sorry, that was 22. I had the wrong number up. That was just in case anybody's wondering. That was pitch number 22. All right, number 23. Bassam Al-Asali, you're back up.
Hello?
Whoa. Yeah, how'd that happen? Go ahead. Try again. Try to speak a little quieter, Bassam. We're getting some reverb over here.
Hello?
Go for it. All right, good. We got you. Yep.
Awesome. All right. So the second idea that I had is that COVID brought a fundamental shift in how healthcare is accessed. Healthcare includes group sessions such as group therapy for sexual assault survivors, drug rehab support groups, mortal illness support groups, and more. And normal groups were disrupted by pandemic, leaving these people without access to their support groups at a particularly tough time in their lives.
Sorry, I muted myself. Excellent. Thank you very much. That was pitch number 23. Number 24 is okay. Next up, pitch number 24 is John Zhu.
All right, can you hear me?
Loud and clear. Go for it.
All right, great. Hi, I'm John. I'm a nursing student at Penn Nursing. And one issue that I've seen a lot through my rotations is that patients often suffer from poor sleep quality. And this is mainly due to the fact that nurses frequently take assessments and vital signs in the middle of the night, which wakes patients up. And also, there's often loud noises in the hospital and loud IV machines. So I'm thinking of working in the wearable devices track to try to address this issue.
Excellent. Thank you very much. That was pitch number 24. Pitch number 24. Next up is, that's it. All right, everybody. Round of applause. Thank you. So that was, oh, wait, never mind. There's one more, which is a good thing. Okay, what are we going to give you? 25? All right, pitch number 25 is Drishti Tayori. Go for it. I think we can hear you.
Oh, okay. Sorry. Yeah.
Oh, yep. We hear you loud and clear. All right. You're up. Go for it.
Yeah. So hello, everyone. I'm Drishti Tauri. I'm a user experience designer, and our pitch is about prosthetic devices, wearable device. So how might we help athletes with disability to improve their physical performance with the smart prosthetic devices? As running with a prosthesis places more stress on the body, adaptive athletes need to work hard to strengthen their body. So currently they are not able to record and are unaware of how much energy would be returned. So these smart prosthetics can help them record the physical performance data and act accordingly and improve their physical performance. So this is our pitch. Yes, thank you.
Thank you very much. All right. I think that was officially the last pitch for tonight. So round of applause. All right. That was fantastic. Thank you, everybody. Thank you, everybody, for getting up on stage and pitching. Now, this is something that just popped into my brain. If somebody pitched multiple times, what Slack room do they exist in? Because obviously they can't be in multiple places at once, can they? That is true. You do get notifications for the other. So this is how I'm going to solve that. So people who have pitched multiple times, there's I think one person to pitch 3 times. Make sure you join all 3 rooms, and it's up to you whether you'd like to monitor all 3 rooms or if you'd like to leave a note in 2 of your rooms and tell people who come there that you are in room X, Y, room. So that's up to you how you handle that. But start by, joining all 3 rooms so people can find you according to your pitch. And then, yes, and then you can send them elsewhere if you want. I'm going to give an opportunity for any questions because this is a really important stage, right? Because now is where the magic happens. Networking and finding each other is tough, except when you both share the same wants and passions. So please do look at, hopefully you all took notes. If you forget or there's a misconnection somewhere, we're going to work really fast to get this spreadsheet that we've created with each problem, each of your names, and each of your and each of your numbers up on the participant guide as soon as possible. The video will take time. We're not going to get that up that quickly, but we'll be able to get that that spreadsheet up on the participant guide and probably within the next few minutes. So if you're looking to track somebody down or you miss something, you can go there.